All right, good morning, everyone. I am Nichelle Mullins, and I am the president and CEO of Charter Oak Health Center here in Hartford. And I am joined today by a company of great men. Behind me, I have U.S. Senator Richard Blumenthal, Governor Ned Lamont, Dr. Reginald Eady, Mayor Luke Bronin, Councilman T.J. Clark, Representative Brandon McGee. I think that's all who's behind me. So today we are delighted to formally announce our partnership with St. Francis and Trinity Health to provide mobile testing in Hartford. With the assistance from the City of Hartford, our teams have developed a list of testing sites throughout Hartford. Testing will be provided free at our sites through June 18th. No appointments are needed. Walk-ups are welcomed. Locations will be posted on the Trinity Health website as well as Charter Oak Health Center's website. You can also find site-like locations and dates on the City of Hartford's website and through their daily social media blasts. Today we are testing here at Parker Memorial Center on Main Street in Hartford until 4 p.m. This is where I've spent many afternoons as a young girl after school in this community center right behind me, and I am honored to serve Hartford in this capacity today. Thank you to everyone who has contributed to this partnership, Mayor Bronin, Representative Brandon McGee, and the Black and Puerto Rican Caucus, and to all the esteemed individuals standing behind me. Without further delay, I welcome to the podium Dr. Reginald Eady, President and CEO of Trinity Health of New England, to give few remarks. Thank you.
Thank you. So first of all, thank you, Attorney Mullins and Charter Oak for your partnership. You know, just when Attorney Mullins and I were having the conversation about the possibility of vulnerable communities being forgotten during this pandemic, support came out of everywhere. So thank you for the support from Mayor Bronin, of course, Governor Lamont, and Senator Blumenthal, because these type of partnerships make the difference. This partnership and program brings free COVID-19 testing into the neighborhoods and backyards of those facing barriers to accessing testing units. The mobile testing programs will travel to, at least at this point, 19 different locations over the next 7 weeks. Joint efforts to expand testing throughout Connecticut and the region remains a critical component to the safe, gradual reopening of the state. And we're doing our part to make sure that it happens in a timely manner, but most importantly, safely. Each mobile test site is staffed by individuals, of course, from Charter Oak, and I am proud to have some of our colleagues here from Trinity Health of New England. Since the start of the COVID-19 pandemic, Trinity Health New England has launched, as you guys I'm sure know, 3 drive-through COVID-19 testing sites. And these drive-throughs allow us to utilize services of high quality and expertise. Both local and national diagnostic laboratories have partnered with us, as well as we've launched in-house testing at several state member hospitals. To date, Trinity Health in New England has tested over 30,000 community members. And also a special thank you to Representative Brandon McGee, because while I am new to Connecticut, every time I've seen him during the pandemic out in the community, he's nudged me and said, when are we going to do more testing? And so to that point, I'd like to bring up to the microphone the representative so that we can nudge him a little bit to learn more about what he's doing.
Thank you. Thank you, Dr. Eady, and thank you to Attorney Mullins as well. Again, Brandon McGee with my quarantine look here, so got a lot of hair going on. But thank you all so much for your efforts on this. With the support of Trinity Health and Charter Oak, I am grateful, extremely honored to see that all of the work this spring in advocating and pushing for federally qualified health centers to provide testing has become a reality this week. And opening these 19 locations, this wave of mobile testing sites will deliver COVID-19 kits to communities and neighborhoods that need them the most. And will find some of the gaps and care that we have seen here in Hartford and in other cities across Connecticut during this pandemic. As already mentioned, no appointment is needed, no testing, no cost rather. Testing is not just the right approach, it is the moral thing to do. Just as the pandemic has hit some of the communities of color than others, so has the consequences of unequal access to health care both during COVID and historically. Again, thank you to Governor Ned Lamont, Senator Blumenthal, Mayor Bronin for taking a clear stance in support of these mobile testing sites. It may be a cliche to say this at this point, but we know that this virus knows no boundaries, no borders, so we need to do our part in reaching the most vulnerable communities in the state of Connecticut, especially the city of Hartford. Thank you so much for this opportunity, and at this time I'd like to introduce City Councilman Thomas Clark.
Thank you, Representative McGee. Good morning, everyone. First, I would like to thank everyone who helped participate to make this event and these events possible. Thank you for this new form partnership between Trinity Health of New England with Dr. Reggie Eady, Attorney Nichelle Mullins of Charter Oak Health Center, our Mayor Luke Bronin, the Governor and Senator Blumenthal for their efforts and their advocacy to make sure testing is available without restrictions. This is what we have signed up to do as elected officials, to be advocates for the community. And we want to make sure that there are various locations within the city of Hartford and partnering with our neighboring towns to make sure testing is available for all residents. As we know, this virus has hit the communities of color very hard, and has been a huge impact on people who are the most vulnerable. So it is our duty to make sure that all barriers are eliminated, to make sure that those that want to get tested are able to get tested. So you will see a huge number of sites that are going to be released later today, hopefully for the rest of this week, to let you know where are we going to make sure that everyone has the opportunity to get tested. Whether you are a young child, whether you are a grandparent, whether you're just a parent, we want everyone to be encouraged to get tested. It's free, it's free, it's free. And this is what a community partnership, a private and a public partnership is all about. And I join with the rest of my colleagues on the council, supporting Representative McGee and the Black and Puerto Rican Caucus, Trinity Health of New England, Charter Oak, Mayor Bronin and his team, Governor Lamont and his staff, and Senator Blumenthal and the rest of the delegation to make sure testing is available for everyone who wants it. Thank you very much. And now with that, I would like to introduce our health director, who has worked tirelessly in partnership with all that have done this to make this possible, Leonie Arroyo. So it is our duty to make sure.
Good morning, everyone. Since mid-March, when the city received word of its first case of a COVID-positive resident, we have mobilized and we have reached out to our partners to help fill the gaps that we needed to get filled and to make sure that whatever response was being generated by the city and the state had communities of color and vulnerable communities at the forefront. Through our commitment to that and our partnerships with the state and our local agencies here, we have seen people come together, we have seen agencies come together, and that coming together has really reaped benefits for our residents. We've seen a dramatic increase in the number of residents being tested from the start of this pandemic till now. When more testing kits became available and there was an expansion of testing, we saw our partners immediately raise their hands and say, we are here, we want to partner, what can we do? And that partnership has led to many more residents here. Whenever we have mobile testing sites, we see an increase, a noticeable increase in how many residents of the city of Hartford are getting tested. It shows that partnerships work, that when we work together as a community, that we can ensure that everyone is being reached. So I look forward to continuing to partner with Charter Oak and Trinity Healthcare at these sites to help them with publicity, to help them get the word out into communities so that we can ensure that everyone has access. Quiero decir algo muy poquito en español. Lo que hemos visto teniendo estas colaboraciones con nuestras organizaciones aquí en la comunidad es que cada vez que tenemos pruebas móviles, vemos que hay más residentes de la ciudad de Hartford que se están haciendo la prueba. Vemos que nuestras organizaciones que colaboran con nosotros siempre están al frente, siempre están levantando la mano, preguntando cómo pueden ayudar. Hoy le queremos dar las gracias. Queremos decir que estas colaboraciones están funcionando. Cada vez que tenemos pruebas móviles, vemos más personas de la ciudad de Hartford que se están haciendo la prueba porque estamos haciendo que estas pruebas sean más accesibles a la comunidad, porque estamos en la comunidad. Así, gracias. Y con esto quiero presentar a nuestro alcalde, Luke Bronin. And with that, I would like to introduce the mayor, someone I'm very lucky and happy to work with, Mayor Luke Bronin.
Thank you so much, Liani. Thank you for the work that you and your team are doing. And I want to start also with a huge thanks to Trinity Health of New England, Dr. Edie and your team, and to Charter Oak Health Center, Nichelle Mullins and your team. This is a really powerful partnership. You know, we are fortunate in this city and in the state to have tremendous healthcare institutions. And both of our hospital systems are working tirelessly to test. But what's so powerful about this is that we know in this moment, as we expand testing, the relationship with the community is critical. Trust is critical. Charter Oak Health Center, like our other FQHCs, is community-based. It is a trusted partner. And to have Charter Oak out there working side by side with Trinity Health to bring testing to our neighborhoods, to hit these 19 sites in the weeks ahead, to make sure that we're meeting people where they are with trusted voices, trusted advocates, trusted partners, makes a huge difference. So I'm incredibly grateful to Trinity Health in New England and to Charter Oak Health Center. I also want to echo the thanks to the governor, to Senator Blumenthal, and to our entire delegation. The governor and his team have made the expansion of testing a priority. And working together, we're seeing that capacity expand dramatically. And of course, Senator Blumenthal has been an advocate for so many things that matter for our community. And although we're here about testing, I just want to give a particular thanks to him for his efforts to fight for support for our small businesses especially, which we know have been devastated, and he is leading the charge to make sure that we get additional support to them. So I'm grateful to him for that work. I want to thank Representative McGee, in whose district we sit. I want to thank Councilman Clark, as well as Chief Freeman. You know, this is a team effort, and working together as a team over the last couple of weeks, we have seen the number of Hartford residents who have gotten tested double. So just in the last 2 weeks, the number of Hartford residents who've been tested has doubled. And that is because of a multi-pronged effort. We now have 9 permanent testing sites in the city of Hartford. That includes Trinity Health of New England and Hartford Hospital. It includes all 4 of our FQHCs, including Charter Oak Health Center, which, by the way, is still offering testing every day at their Grand Street location, even as they do this mobile testing. It includes the 3 CVS stores on Blue Hills, Washington Street, and Weathersfield. And I think we'll be announcing another site very soon. So we have a significant number of permanent sites, and I think it's important to say that because you don't have to wait till this testing comes to you. In this small city, there's testing available to you. Seek it out, get tested. But we're going to do everything we can to make sure that you just have to walk around the corner to get tested, because we want everybody to get tested in these weeks ahead. As Dr. Edie said, it is critical to successful reopening that we dramatically expand the number of tests that are administered, that testing becomes a routine thing, that it's not something you do once when you have symptoms, it's something you do no matter what, and then you do it again, and then you do it again. And with the goal that the governor and his team has set, that will be possible in the months ahead. Lastly, let me just stress the thing that has become the mantra over the last couple of weeks. You don't need insurance, you don't need a prescription, you don't need symptoms, and you don't even need a ride, because if you call 311, we'll drive you to the testing site. There's nothing to be afraid of. There's no reason not to get tested. And if you've got family members at home who you love, if you've got elderly in your life, if you've got anybody you're near, if you're working, if you're just going out to the grocery store, get tested, because it's not just about you. I think the word is getting out there. I think that we're seeing really significant turnout at our testing sites, but we need to continue spreading the word, because early on the tests were so limited that the restrictions on who could get tested were very severe. That's not the case anymore, thanks to partnerships like this, and we want to make sure we do everything we can to drive that word out. So thank you again, Governor, and thank you, Senator Blumenthal, and it is a true privilege to turn this over to our senator who's fighting so hard on our behalf, Senator Blumenthal.
Thank you so much, Mayor. I want to begin by giving a great big shout out to the heroes, and I really mean the heroes of the Charter Oak Health Center and all the federally qualified health centers in Connecticut. As you know, there's 17 of them. They are the backbone of our healthcare network in the state. They are providing critical health care to the underserved, and they have been hard at work. They are heroes, and they're one of the reasons why I propose a Heroes Fund, hazardous duty pay for every one of them, every one of the folks who's been working hard throughout this period, and I think we ought to give them a shout out right from the start. Hazardous duty pay that begins January 27th, retroactive, goes to the end of the year, because they've been under such stress and sacrifice so much. And this partnership, Trinity Health and the Charter Oak Health Center, is what we need to reach those people who have been underserved in our community. Let me be very blunt. The disparity in deaths between poor, black and brown, and other communities is a national scandal. It is a disgrace and embarrassment to the wealthiest, most powerful country in the world. It is a stain on the greatest country in the history of the world. And so this mobile testing site has a particular significance because it helps to overcome the disparities that have plagued this effort. Now, you remember, anybody who wants a test can get a test. You remember when it was said. Wasn't true then, but it is true now. Anybody who wants a test, and that means you should want a test, can get one easily, painlessly, costlessly, and you should do it to help yourself and to help your family and everybody who is in contact with you. And the reason those tests are available now is because of our governor, who has fought tirelessly and relentlessly. He's been at the tip of the spear of this national effort with other governors, and because of the mayor of Hartford and other mayors and first selectmen around the state of Connecticut and the country. They are the heroes of this effort politically, and that's the way they'll be seen by history. Now, we still have a lot to do in Washington, and part of it is to provide the funding that's necessary for testing. In order for all the tests to be available for people who need and deserve them, we need the funding that is in the latest package of relief spending, the HEROES Act. And by the way, those heroes should get that kind of recognition through the HEROES Act. It will be on the floor of the Senate next week if Mitch McConnell allows it to go there. So I'm going to go back to Washington, to Mitch McConnell, and I'm going to say, come here to Connecticut. See the mobile testing centers we have here. See the kind of community effort that is ongoing. That's what we want for our nation, to turn the tide on this insidious disease so we can fully reopen the economy, because people are not going back to school or back to work or back to the stores until they feel safe. That means testing and contact tracing, and that's what Connecticut is doing. And one last word, you've seen the numbers issued yesterday about what the towns and cities have suffered in financial loss, in the billions of dollars. Well, if that HEROES Act is passed, Connecticut towns and cities will receive $3.9 billion. $3.9 billion in state, in local aid alone. Municipalities will receive $3.9 billion, and the city of Hartford will receive a total over the next 2 years of about $250 million to compensate for the costs of this effort and other expenses that are involved in conquering this pandemic. So I'm proud to be here today with one of the great mayors of the country and certainly one of the great governors of the country, and happy to be followed by Ned Lamont.
Well, thank you, Dick, and good morning, everybody. Just give a little update since it's been a few days. It's been about a week since we launched our May 20th reopening. It's worth stating that all the key metrics are headed in the right direction. That means hospitalizations continue down. I think they're about 2/3 off their peak. Reggie can remind me, that means we got capacity at Trinity Hospital. Don't put off those operations any longer. You can be able to do that. I'd also remind you that testing continues to go up. And, you know, early on we were restricted. We were running after swabs. We were looking for the reagents. Then we said we'll have testing, but you've got to come to us. And what this partnership with Charter Oak and Trinity means is we're going to bring the testing to you and make it easier for you to get tested. And as you know, Luke said so eloquently, testing is not only about your own sense of self safety, that you know you're okay, but each and every one of the people around you. It's a sense of respect for them as well that you're getting tested, so they know that they can be safe with you. And a lot of that about the mask is about them as well. And yeah, it was could have been very expensive for us to be able to do this. And thanks to the good work of Senator Blumenthal and Congress, they got a few things right down there. One is the importance of testing and how we get this rolled out. You know, testing is, I think, as Luke said, it's also about trust. You've got to be knowing you want to get tested and knowing it's important to get tested. We were down, you know, Dick and I in New Haven yesterday. They had the pop-up testing. They took it to the took it to the green. It was sort of interesting. The day before, they had capacity for 100+ tests, and they did maybe 35. And as Luke said, when it comes to trust, I need each and every one of you. You know, Brandon, I knew you'd have the coolest surgical mask, by the way. But what you can do, Michelle, to keep talking to the community when it comes to trust, what it means to bring people out, get them, make it easier for them to be here, and why it's so important. And I was reading about the passing of Larry Kramer this morning, an AIDS activist, back during another pandemic. When he had to read the riot act to Dr. Fauci, if you were reading that, sort of interesting. Dr. Fauci was an infectious disease expert even back then in 1981. And what we learned, there they blamed the victim. Today people maybe aren't taking this quite as serious as they could, especially on the backside of this pandemic. And that was the beginning of track and trace, at least in the modern era. And it's sort of interesting to me that UConn now has a course on track and trace, led by a professor who's a leader in getting that implemented during the AIDS pandemic, going back a generation. I hope that we learn from these episodes so we get it better next time. And one last thing, you know, Dick, tell Mitch McConnell we don't want to wait and see any longer about this budget. I mean, Luke Broden's got to put together a budget. We've got to put together a budget. We got another 168 towns. They're ready to see what their budget's going to look like for the next fiscal year. And your support from the federal government is key. It's key to our planning, key to our getting it right, and key to our being able to make testing available to each and every one of the people here in this town that need it. Look, Hartford was hit hard. Hartford, I think, has second highest fatalities right now as a city, I think, in this state behind Stanford. And that's why when it comes to going to the folks who most need the testing, most likely to get infected, most likely to have complications, we're bringing the testing right to you. Special thanks to Charter Oak and Trinity. Thanks, everybody.
The issue of trust, of what in your view has been a barrier so far, and how is it being addressed other than the obvious outreach of it?
Okay, that, Brandon?
I think when you begin talking about community partnerships, just to answer your question directly, there have been so many reports on what types of tests are out there, whether or not you need money or insurance. And so many of the folks in the community are really relying on the traditional way of communicating. That's picking up the phone, talking to your folks through your church networks, and really figuring out, okay, where do I go if I feel like I need a test? And so what's been happening throughout the city of Hartford is a lot of leveraging on existing efforts throughout this city. So there are food operations throughout the entire city of Hartford in partnership with the city, and many churches who are feeding on a daily basis. Those very people who are coming to get their bellies filled with food are the very people who are saying, where do I go to get tested? Why? Because they trust the people who are feeding them. They're in the community, their faces in the community as well. As chair of the Black and Puerto Rican Caucus, we've talked a lot about how to elevate influencers throughout the state, right? So you need some more black and brown faces, not limited to, but black and brown faces who can speak directly to many of the families and young people throughout this state on the importance of getting tested. Whether you have symptoms or not, you should go get tested. So I would really underscore the importance of leveraging existing initiatives. Our federally qualified health centers, they're out there on the front line, and many people have a lot of trust in them, which is why it's important we provide funding from the federal and state level to support many of these institutions that have a direct connection to our communities.
Do you have a reason why Hartford has the second highest fatality rate? Do we have more comorbidities in Hartford?
So I don't know yet that anybody can answer that with full confidence, but if you look at the Hartford region, both the city and towns, particularly West Hartford and Bloomfield, there is a very high concentration of nursing homes. And we have been looking carefully at the data to try to understand those numbers. And I think, as you know, fatalities have been highest in our nursing homes. They've been hit hardest throughout the state. And given the very significant concentration of nursing homes here, I think that is a part of the fatality rate here. But as many others have said eloquently, it's also true that urban centers around the country and communities of color around the country have been hit hard for many reasons. You have more multi-generational living. You have more dense living, more apartments. You have more difficulty social distancing at home. You have a higher number of people who are in jobs that have been deemed essential to be on site. You have more folks who are working as first responders. And there's no question that you have the legacy of generations of health disparities and significantly higher pre-existing conditions, underlying health conditions that make folks more vulnerable. But again, I do think that a big part of that fatality rate is the concentration of nursing homes. And can I just speak real quick to the question that Paz asked also? I think when you hear from somebody, a government official, somebody like me, or from a hospital exec, that you're not going to have to pay, you're not going to get stuck with a bill, that there's not going to be some unintended consequence of getting a test, you might believe it. But if you hear it from the FQHC, where you get your primary health care, you may trust it in a different way. If you hear it, as Brandon said, from your pastor, or you hear it from a community organization that's out there delivering food, I think you may hear that in a different way. And I think that because so much of our promotion effort, including for this one, is based on those partnerships. We've been able to see some really successful results at the mobile testing. The testing that was done down at Phillips Church over the last couple weeks drew about 300 people both days. The testing down at Batchelder last week drew 300 people, and that's because in addition to the partnerships to administer the test, there were the partnerships of churches, of nonprofits, of community-based organizations getting out there and spreading the word, and that's the model that we're building on.
You know, there's one other point, Pat, which I think is very, very important here. I was standing in line yesterday down in New Haven, not standing in line, but talking to some of the folks in line, and it reinforced for me one of the concerns that is raised, which is privacy. A lot of folks are reluctant to get a test because they're not sure who's going to learn about it. Now, I was tested yesterday. I tested negative. I'm choosing to disclose that fact, but the results of that test were going to be made known only to me. People should know that this information is yours and yours alone. It doesn't go to your employer, doesn't go to your family, it goes only to you. And if you choose to tell anyone, that's your doing. But if your choice is to keep it private, you can keep it private. So this privacy issue, I think, is very important. I've heard a lot about it from folks, and I think they need to be reassured that no matter what the results, they will be private. As a matter of law, as a matter of federal law, as you know, they have to be kept private.
Thanks for all your questions. I'm joking.
Are there any plans to set up mobile testing sites in Waterbury? I'm looking at the city of Waterbury's latest update from yesterday, and it says you still need to have a prescription from your doctor to get a test. Just heard the governor and the mayor talk about bringing testing, the importance of bringing testing to the community. What are Trinity's plans regarding Waterbury?
Yeah, so we treat all of our regions exactly the same, right? So you don't need a prescription to get tested at any of the Trinity Health New England facilities. So in Waterbury, as you're alluding to, is St. Mary's. Of course, here we have Mount Sinai and St. Francis, and we have Johnson in the Stafford and Springs area. So no prescription is needed. And the reason why is because we provide the prescription for you. Because of our new virtual care operations, in real time, when a citizen shows up to a Trinity Health of New England testing site, we will virtually connect that person with the provider. The provider then provides the prescription, and then the testing is done. So this is seamlessly. This is asynchronous provisions when it comes to a test. We are in conversations now, so I am talking to Attorney Mullins about expanding this. And if for some reason there's a restriction with Charter Oaks, we will find another way to provide mobile testing. But as you know, I mean, when you look at the complexity around this virus and compares to Waterbury in Hartford, there's a difference, right? And so we wanted to start here because we saw that it would have a greater impact. But our intentions are to expand it throughout the territories that we service.
Well, actually, there's only 360 more positive cases in Hartford than there are in Waterbury. According to yesterday, there were 1,833. So are you in discussions with the city of Waterbury? Are you in discussions with the Lamont administration about making arrangements to provide mobile testing in the city of Waterbury or not?
Yeah, so when I say I'm in conversations, I'm speaking with Charter Oaks and their leadership team. So Attorney Mullins and I are in conversations. And I can get you an answer within the next 24 to 48 hours if that's what you're insisting on.
Well, no, I mean, everybody's been talking here at this news conference about the importance about bringing testing to communities. Yeah. And right now, there's only 2 drive-through testing sites in the 5th largest city of Connecticut. So I'm just wondering, what are the plans?
Yeah, that's the plan.
And I can add as well that there are FQHCs in Waterbury. Staywell is one of them that is conducting testing as well. And the FQHCs are having conversations with the Department of Public Health and the Department of Social Services about broadcasting a statewide testing plan, utilizing all of the 17 FQHCs throughout the state, and Waterbury is on that list. And there's a call today at 11:30 to discuss that even further.
But there are no plans at this moment to establish mobile testing in Waterbury.
I'm not sure how many different ways to give you this answer. The answer is we are in the process of creating a strategy to provide mobile testing in Waterbury.
Dr. Reed, blocking to actually get tested. How are you guys going to make sure that people are staying safe while they are here, especially with such a large crowd?
Yeah, so I think the governor has given us clear guidance on how to demonstrate safety when in a public setting. So masking is going to be expected. Social distancing by at least 6 feet.
6 feet.
So we're going to follow the governor's recommendations. If you go to ct.gov, you can see what I'm alluding to, and it's very clear as to what his expectations are, and we've committed to complying to both the safety of the citizens of Connecticut and, of course, our governor.
Governor, now just a few days away from the casinos planning to open their doors, where are your talks with them currently standing beside?
Well, as you know, we've gone out and visited both Foxwoods and Mohegan Sun, our healthcare team, looked at some of the protocols they put in place. We've given them in written form some very specific suggestions that we think would, potentially save lives and up the healthcare protocols a lot. I saluted them. I said, look, you're a sovereign country. You've made that very clear. And you didn't have to, but back in March, a considerable financial hit to yourselves, you did close down those casinos. And here we are 2 months later. We have some of the lowest infection rates, not just in the state, but in the entire region in eastern Connecticut, in part thanks to the incredible sacrifice the tribes made. Obviously, you've heard from me. I think the idea of opening up on June 1st is early. It's earlier than Las Vegas. It's earlier than any of our regional casinos want to do. I'd like to have a little more time. Short of that, I'd like them to put in stricter protocols. I think that's key for the public health of customers going in, their employees, and the greater region. I look at California. I see the tribes there voluntarily said we're not going to serve alcohol. You know, alcohol is not great for social distancing. You're taking off your mask. I thought that was a really important voluntary effort they made there. I see in Maryland they've capped capacity at 30%, not just 30%, 30% of the part of the casino that's open. Make sure that that social distancing is very possible. I see Oneida up in upstate New York. They've limited the group of people that can go to that casino to say, I can't remember, maybe 50 miles in a circumference to make sure you're not attracting people from New York City and Boston to come to your casino. There are some things you could do that would make a big difference in terms of public health.
Governor Lamont, while you're up here, can you also talk about hair salons and barbershops? I know that their original opening days were 6 weeks ago. We bumped it back. How are you feeling ahead of that reopening on Monday?
I know that a lot of the barbers, particularly the salons, particularly the stylists, said give us a little more time. We said 10 more days. We wanted to make that more or less coincident with Rhode Island and Massachusetts. They're pretty much on the same time frame. And I think they appreciate the time, and I think they're ready to open. And looking around here, I think there are a lot of people who are ready for them to open.
Related, you said that all of the key metrics are moving in the right direction. The testing actually fell in the past week. Would you consider closing things back up if testing doesn't reach the benchmark you set previously? Would you consider holding off on the second phase if it doesn't reach 100,000 initially?
We'd certainly take a look at that. I'm very confident. You know, thanks to the work of the people right here, not only do we have the capacity, but now we're going to be getting people in to test. It fell off a little bit over Memorial Day weekend for reasons you can probably understand. We're doing everything we can to ramp that up to 42,000 and beyond per week.
Governor, can you ask the Republican leaders to call for a special session concerning your executive orders?
You know, I say go for it. I don't think I call special sessions. I think they call special sessions, and when they feel comfortable coming in, you know, that's certainly their right. If you did it through Zoom, makes a certain amount of sense to me, but that's their prerogative.
Well, do you think we should be taking action either to amend the emergency declaration laws that would give the legislature more authority to respond to your executive orders, either to amend them or rescind them?
Or just give me a call. Tell me if there's an executive order you don't think is appropriate. Tell me what it is. I get mixed signals a little bit from the legislature. You maybe remember for every other day the Democrats in the Senate were saying, you're opening up too fast, you're opening up too fast. And now with the tribes opening up, inside 65-year-olds drinking, I said any statement on that, and it's been crickets. So But I'm happy to get any feedback I can from folks who have some input.
Well, shouldn't the legislature have the authority to call its up in a session and take any action it wants regarding any sort of order that you made?
Well, certainly the first part, they have the right to go back into session anytime they want to. From there, let me ask Bob Clark.
Governor, have you looked at what you're going to need legislative action on as far as keeping some of your executive orders in force past September 9th when the public emergency expires?
The only thing I care about, I think, in terms of what we can't do after September 9th is voting. I mean, I would like to see absentee balloting available in November, not just for our August primary, and I'm told I can't do that unless the legislature steps in and takes the lead on that, and I strongly urge they do. Otherwise, you're right, Paz, all of our other executive orders come off at the end of that 6-month period, I guess that is, and that's probably appropriate.
Well, but I'm not saying they're going to do it, but theoretically, the Hartford Yard Goats on September 10th, if baseball wanted to, they could try to have 7,000 people at the ballpark, at the XL Center. We could have hockey, we could have concerts at 10,000, 15,000. So is that a concern after some period after September 9th, having the ability to sort of hold off on events beyond the 100 that I think is in the fourth state?
Hey, that September 10th is a long way away, and I can't tell you what the world's going to look like. Look at how it changed in the last 30, 60 days. You know, as Paul said, look, maybe the legislature has strong feelings. They'd like to step in at that point, and or maybe they'd say, Governor, I think you've done okay. I'll see. And, you know, we'd like to continue this a little bit further because you're putting public health first, not politics, when it comes to these protocols. That's a long way away. I'm going to worry about that later.
Going back to hair salons and barber shops, you were saying that you appreciate that people were asking for more time. What would you actually say to those salon owners? Because we've heard from many of them that felt like this really made things even tougher for them. You know, that they're hopeless about it. What would you say to them today?
I'd say it's in 3 days you'll be opening up along with our neighbors in the regional other states, not counting New York. New York has kept everything closed down. I know you put in some money hoping to get the barriers and things you needed to do it safely on May 20th. It's just as relevant on June 1st. That investment was well taken. You're keeping your people safe, and customers are going to come in now because they know it's safe. Thanks, everybody.